Hi everyone, my name is James, and with my partner Chris, we'll be talking about Tinea pedis. First things first, what is Tinea pedis? Tinea pedis, commonly known as athlete's foot, is a type of fungal infection that most commonly affects the skin of the feet. It is usually found along the webbings of the toes and in some cases on one or more of the toenails. Tinea pedis is caused by dermatophytes. Trichophyton rubrum, Trichophyton mentagophytes, and Epidermophyton floccosum are examples of dermatophytes that most commonly cause Tinea pedis, with Trichophyton rubrum being the most prevalent dermatophyte in the world. Once the skin is contaminated by the dermatophytes, the warm, moist environments of most shoes creates the perfect breeding ground for the fungi to flourish and thrive. Tinea pedis is extremely contagious and can spread from person to person directly through skin contact as well as indirectly through interaction with contaminated surfaces such as showers, bathroom floors, locker rooms, and shoes. The dermatophyte fungus requires keratin to grow as it is the main source of nutrients for the dermatophytes to multiply and spread. Now, a lot of you might be asking, what do you look for when it comes to Tinea pedis? Well, those who are infected by Tinea pedis will most commonly show signs of dry, red, scaling, and itchy skin on the interdigital spaces of the toes. Common signs of Tinea pedis involves a squamous rash. This rash usually begins in the middle of the toes. Symptoms of the rash include itching, which is aggravated right after the person removes their shoes and socks. Some of the other common defining features of athlete's foot include blisters or ulcers. Symptoms of these blisters or ulcers include increased pain, therefore difficulty walking. The moccasin type of Tinea pedis generates chronic dryness and scaling on the soles of the foot that usually spread up to the lateral side of the foot. Further inflammation can occur when the blisters break apart, exposing the raw areas of the tissue. In some cases, the rash-like skin infection will be present on other parts of the foot that are exposed to the warm, moist environments, such as the sole of the foot. In some cases, the infection spreads to the toenails, which causes the nail to become strangely thick and become a cloudy yellow in color.
So, as we're looking into the clinical course of Tinea pedis, the dermatophyte relies on keratin to survive primarily, as it provides nutrients for it to divide and multiply within the skin. Persistent infection includes immunologic unresponsiveness by activating suppressor T cells. It also remains in the stratum corneum, which is a very deep layer in the skin. It also evades immune surveillance. If untreated, the infection can proliferate through airborne mechanisms to other areas of the body due to having a weakened immune system. The host is more susceptible to secondary infections. Hygiene precautions must be taken very seriously in order to prevent possible reinfection.
Now, a lot of you might be asking, how do I know if I actually have it? Well, you don't have to worry about that. If you go to any of your healthcare professionals, such as a doctor or podiatrist, they can typically diagnose Tinea pedis due to their extensive study and research into skin conditions affecting the foot. A healthcare professional will ask about the symptoms the afflicted is experiencing, as well as whether or not the patient partakes in activities that can increase the chance of being infected by Tinea pedis, such as the use of public facilities such as gyms, swimming pools, and showers. Questions regarding the everyday footwear that the patient wears can give the healthcare professional a better understanding of whether or not the symptoms present are due to Tinea pedis. Due to most of the symptoms being visibly present on the skin of the foot, healthcare professionals can typically diagnose Tinea pedis by examining the affected feet with sight alone.
So you might be asking yourself, how do you confirm your diagnosis? So there are two main ways in order to confirm your diagnosis. The first way is using the KOH test, or also known as the potassium hydroxide test, whereby you get a skin sample of the affected area and dilute it with potassium hydroxide and put it over heat, and whatever isn't evaporated is the potential fungal specimen. The other way that pathologists and doctors also use is they get a section of the affected area, skin scraping, and send it over to a pathologist, and they test out what type of microbe it is under a microscope. These tests, in conjunction with clinical history taking, is paramount. Without it, misdiagnosis can occur and maltreatment can follow, leading to the worsening of the condition.
With Tinea pedis, treatment is quite simple. It's typically treated with over-the-counter medication, so if you go to any local pharmacy, you can just buy these. Antifungal creams are normally sufficient to treat mild cases of tinea. Antifungal creams are usually applied twice daily until the skin is healed. It is recommended that treatment continues for a further 2 weeks after symptoms disappear to avoid reoccurrence. Common antifungal creams include Canesten, Lamisil, Dactarin, and Peveril. In many cases, reoccurrence does occur due to either the course of the treatment not being fully completed or re-exposing feet to warm, moist conditions. In some cases, the battle with Tinea pedis can be prolonged for years. For more extreme Tinea pedis, an oral antifungal medication can be prescribed by your doctor. Those with mismanaged Tinea pedis risk bacterial infection, which would require antibiotics such as penicillin to treat. If the infection spreads to the toenail and visibly worsens, toenail removal may be necessary.
For those looking for a more natural alternative, or a non-pharmacological intervention includes the use of tea tree oil as a natural remedy to eradicate the fungus. It doesn't seem to be very effective with only a 30% success rate. However, it is a good alternative for patients who are allergic to conventional interventions. However, it is advised to warn the patient that it may not work entirely. It may not eradicate the problem, but alleviate some symptoms.
And now, probably the most important point to make is how to prevent Tinea pedis. So curing Tinea pedis isn't predicated on just medication and antifungal treatment alone, but in combination with lifestyle changes. Ensuring a high level of personal hygiene will create an environment that optimizes recovery and prevention. Drying wet feet immediately and properly to prevent moisture from staying on the feet or in between toes. Wearing cotton socks with shoes that allow airflow to the feet so that the feet have a chance to breathe and stay dry. When at public facilities such as gyms, bathrooms, and swimming pools, protecting feet by wearing appropriate footwear such as thongs instead of going barefoot will ensure no fungi on the floor will come into contact with feet. Avoid sharing shoes with others, and probably the most important tool in preventing Tinea pedis is education. Healthcare professionals must educate their patients on the risk factors of Tinea pedis, as well as how to prevent the spread if the patient is infected. So overall, I hope our presentation helps you understand a bit more about the Tinea pedis and the infection it causes. For those of you looking for further information regarding the condition, here is a list of resources you can use to help you in your search for answers. Thank you.